Hey friends, happy Monday. Our first full moon of the new year. I'm so pumped. Lots of really great energy with the full moon. If you kind of follow all of our astrological cycles, I do. Definitely getting into it because I think there's some power in understanding how our bodies relate to nature, right? So today, if you're joining me for the first time, welcome to our Learn with Flow episodes. We do these episodes every Monday to give us a really long form content to be able to get a little bit deeper into some health and wellness topics of today's world, especially in the world of nutrition, functional medicine, gut health, healing, and hormones. So if you found me, you're in the right spot. Last week, we really talked about this concept of living in a time where we get the benefit of two different healthcare models. A lot of times people think that we're kind of stuck with one healthcare model. And last week I got the opportunity to kind of blow a lot of minds when I started talking about this concept that I teach a lot to my patients, which is understanding that there are two healthcare models. Neither of them are competing with one another. They're actually very complementary to one another if we know how to use them right, and can be very collaborative as well. So if you're, like I said, new to the conversation, I encourage you to go back and watch last week's episode because it was a banger of an episode. And I got a lot of really good DMs and comments from individuals as you guys started to think a little bit differently about navigating the healthcare culture in 2025 and beyond. So just as a high level overview, because we're going to kind of build on that conversation we had last week today. We really shined light last week on understanding that we have two different models of healthcare operating in the world today, which is really cool. So it's a benefit. It's not a curse. We really want to think about this opportunity to take advantage of conventional medicine, which really takes us on this spectrum of dying to surviving. It sounds a little bit morbid, but we absolutely need that model of healthcare where their goal is strictly life-saving measures, more acute care measures, urgent, emergent, and also more, I guess you could call it life or death kind of scenarios, right? So they have their own toolbox, which we'll talk about a little bit more today, where conventional medicine can really swoop in and take us from dying to surviving. Now, the tough part is understanding the limitations of that toolbox, and also understanding that sometimes when we're surviving, it doesn't necessarily mean we're thriving. And this is where most individuals find themselves, especially in the world of chronic health conditions today, where it's not necessarily emergent care that we're seeking, but we're seeking answers to chronic gut issues, chronic fatigue, chronic skin issues, ongoing hormonal imbalances, fertility concerns, right? So when chronic health conditions kind of take over and we're like, no, I'm definitely surviving, I'm just not thriving. That's where the second model of healthcare comes in, that being more functional or alternative medicine. So again, these two aspects of medicine, they both have their strengths, they both have their shortcomings, and they're both meant for kind of two different times in our life. But I've seen more and more where individuals are getting very frustrated because they're trying to use the conventional medicine dying to surviving model. They're trying to use that to address and get answers for their chronic health concerns. And it just doesn't really work very well. So they get frustrated because they leave feeling like, I feel dismissed, I feel invalidated, I feel like I didn't get any answers, I feel like I just got pills thrown at me. And it's like, no, like that is their toolbox. That's what they're trained on. That's what they know. And so you're just looking for a different model of healthcare. If you look outside of that more emergent or acute care model, you'll probably find what you're looking for. And so just really kind of bringing to light, I think that analogy, a lot of people haven't heard that dying to surviving versus surviving to thriving kind of model. Mostly because it's a model that I came up with. So it's something that, like I said, if that's new, hopefully that kind of resonates with you as you're thinking about your health goals for 2025 and beyond. And maybe you have felt that. You felt like, no, I've been in that place where I've gone and they've told me my labs are normal, or they just want to throw birth control at me, or an anti-anxiety medication, or another laxative, or kind of some of these more Band-Aid solutions. They do seem like Band-Aid solutions for chronic health conditions because that's not really what their toolbox is really really strong at. So these two models are not in competition. I want to be very, very clear about that. And we're talking two different toolboxes, two completely different scenarios in which they are equally beneficial. They're just best used when we complement these two worlds of healthcare together, and we also function in a collaboration together. So I would expect that individuals would feel extremely frustrated, dismissed, and honestly kind of hopeless when they're trying to use a conventional medicine model for chronic health conditions, or if you try to use a functional medicine model for emergent health conditions, that can also be detrimental too, right? It's like if I'm in an accident and my arm is dangling off, like I'm not going to rub essential oils in it, right? It's like I need emergency medicine in that situation. So we just have to be discerning consumers of the healthcare world and know what model best suits our needs. And that way we don't feel dismissed or frustrated or hit a dead end. And so again, that was just, like I said, a little snippet to kind of set the stage for what I want to dive into today. And so if you missed that conversation last week, go back to my last week Learn with Flo episode under my Reels tab and watch that in entirety, because I think a lot of you had some like really positive light bulb moments go off with that explanation and analogy that I shared. So today I really want to kind of take that understanding of these two different models of healthcare and just go one next layer deeper as we specifically talk about some more details of these two healthcare toolboxes. And when I say toolboxes, I just mean, okay, what does conventional medicine use in its care and treatment plans? And then what does functional or alternative medicine use in its care and treatment plans? We both have two entirely different toolboxes because, like I said, we're meeting two entirely different needs. And one of the biggest places where these two differ in those toolboxes are specifically around diagnostic tools that they might use and lab testing that they might use as well too. And I know lab testing is always kind of a hot topic because people are becoming more and more savvy with wanting to know certain health markers on themselves, wanting to track some health markers in terms of year-over-year trends. And like I said, these days people are just getting more and more in tune with their body and curious about being more proactive about their health. So let's kind of dive in and compare and contrast these two worlds to kind of better understand where they see and utilize different diagnostic tools to really help us identify why are we struggling the way that we're struggling, what are we struggling with, and ultimately come up with a solution, right? That's what lab testing and diagnostic features are for, is to give us that inside look and to provide better care and better specific treatment plans as well too. So ironically, our treatment plans sometimes are only as good as our diagnostic tools. So if we don't have those same diagnostic tools, we're probably not going to get the same treatment program, right? So when I talk about diagnostic tools, let's just dive into the world of more of the conventional lab testing toolbox first. So when an individual is really needing to move from a dying to surviving kind of state, and when we think about kind of our conventional medicine training, our current medical school curriculum and current medical school fellowships and internships, like what are these practitioners getting trained in? Really, the type of testing that we find in more of your dying to surviving toolbox are going to be things like blood work. Blood work panels are very common, right? You might get a CBC, you might get a metabolic panel, you might get a cholesterol panel. Blood work is something that's very commonly seen in a convention medicine model. Imaging, right? We think about x-rays, MRI, CT scans. That side of conventional medicine also uses a lot of like different scopes. You might have heard of like an endoscopy where they take a look from all the way mouth to the small intestine, or you think of a colonoscopy where they think of going through more the rectum, large intestine route just to check things out and look at structurally what's going on in the gut. The conventional medicine route definitely uses urinary testing a lot as well too, specifically for like pregnancy testing, right? That's kind of in the conventional medicine sphere. Biopsy procedures, maybe they're going to grab a tissue sample or a skin sample from a dermatologist, like that's in their toolbox and wheelhouse, or different screening tests like mammograms, pap smears, right? So it's like, oh yeah, I've heard of all of those different kind of diagnostic tools. Those very much belong in more of the conventional medicine sphere. So we need them. We love them for a certain rhyme and reason, but when we think of like the strengths of these types of tests, these tests are going to be helpful for identifying acute, like really short acting, right? Acute illness, infection, injury. So they kind of help us answer questions like, do you have strep throat? Do you have a bowel obstruction? Do you have a torn ACL? Do you have a broken femur? Do you have a hip fracture, right? Or they're going to look at more, I call them like the big scary stuff, right? Things that we can absolutely see as structural issues. So they're going to be necessary to help diagnose more big and scary kind of severe conditions. Like, do you have cancer? Do you have a tumor? Do you have colon polyps? Do you have some internal bleeding, right? So the conventional medicine model, it sounds kind of like big and scary, and it kind of is, because that is the toolbox in which they are trained in. They're there to help individuals that are struggling with some of those like big, scary kind of diagnoses, right? Broken bones, acute infections, growing tumors and cancer, right? It's like, yeah, big and scary stuff. But what I see more and more is individuals are going to their primary care providers. They maybe get referred to like a gastroenterologist or an endocrinologist or a rheumatologist, a cardiologist, a neurologist, right? All of these different subspecialties. And you might get all of the testing run and they're like, well, ship shape, like everything looks great, everything looks normal, and you're like, why do I still feel like garbage then? That is where it's absolutely necessary sometimes to rule out the big and scary stuff for sure. But how many times are we going into our conventional care providers and we're definitely surviving? We just feel exhausted, anxious, I have brain fog, I have weight gain, I have joint pain, I have headaches, I have bloating, my skin is breaking out, and I can't sleep, right? It's like, no, we're surviving. We're just not thriving in that situation. And in that situation, I knew that was going to happen. I hate this tripod. We go into a doctor in that situation, and like I said, we rule out some of the big and scary stuff. That's very, very necessary. But what if we're told, we go with all of those more chronic health symptoms, and we're told, oh, all your labs are normal. It's like, okay, where do I go next? That's then where the surviving to thriving toolbox should take over. Instead of just feeling dismissed, what should be happening in that scenario? I say should be happening. Sometimes it does, sometimes it does not. You go through more of that kind of conventional testing route, and when your labs come back as normal from a diagnostic standpoint, or from like the big and scary stuff kind of standpoint, you should be, in my opinion, you should be then being referred to a practitioner that then takes over from there and starts to help you navigate the surviving to thriving model, right? Someone like myself. But that doesn't always happen. And I'm recognizing that that doesn't always happen. And so we have to, as consumers, we have to be a better advocate for ourselves in terms of what we need to kind of pick up where that model might leave us high and dry, or it might leave us hanging a little bit. So let's take a little bit of a switch then and start to think about, okay, if that's the conventional medicine diagnostic toolbox, what is more of the functional medicine toolbox? If I want to move from surviving to thriving, the question now doesn't become, what do I have? Okay, that's what conventional medicine is trying to answer. They're trying to answer, do you have a broken bone? Do you have colon polyps? Do you have a torn ACL? Do you have strep throat? They're looking for what you have, whereas functional medicine, they're going to start to ask why. Why do you have what you have? Why do you have brain fog? Why do you have chronic gut issues? Why do you have weight gain? Why do you have insomnia, right? We know what symptoms you have. We just need some diagnostic testing to really determine why. Why do you have that? This isn't like we're slapping a label or a medication on the picture. It's deeper than that, because we are looking for early signs of imbalances and early signs of dysfunction, usually before it becomes full-blown disease state. So we're not sitting here being like, oh, your labs are fine, let's just wait it out. Let's just check in again in 6 months or a year. That's not what this is for. Functional tests really guide in understanding how your body is working together as a whole and what is the root cause of a lot of the symptoms that you're experiencing. So when we think about this surviving to thriving toolbox, you're looking at a whole different set of labs here, okay? We're thinking about more, like I said, digging into the why. So things that you'll see in more of a functional medicine standpoint and things that I use in practice with patients, every patient is different, but I might order something like comprehensive stool testing, right? I want to look at your gut. I'm not just looking at a scope. We can stick a camera up there and be like, yep, ship shape. What about the stuff you can't see? We have a whole microscopic living, breathing microbiome in the gut that is ruling everything from mental health, metabolic health, weight gain, all sorts of different things. So we might do comprehensive stool analysis to look at things like gut health, microbiome, inflammation. We might look at more detailed hormone panels, even like a Dutch test where we might look at cortisol levels or sex hormone levels, not just at like one time point throughout the day, but what does it look like throughout the entirety of a day? We might look at things like nutrient deficiencies using organic acid testing. I might use more toxin burden assessment to look for individuals that might be struggling with things like mold, mycotoxins, heavy metals, endocrine disrupting chemicals, right? All of those things that are making you generally feel unwell, even though it's like, oh, your labs look normal. It's like, kind of depends on what labs you're looking at, because chances are, even if your blood work looks normal, I've seen a lot of people's blood work look normal according to conventional standards, and then based off of the labs that we run, I'm like, oh, things are far from normal. We got lots of different things that are probably contributing to why you feel the way that you do. So this more surviving to thriving toolbox is more designed for you if you kind of meet some of these criteria. So if you are somebody who has kind of gone through some of the conventional medicine sphere and you generally feel unwell despite your labs being normal, then this functional testing diagnostic toolbox is probably for you. Or if you have chronic symptoms that more of your conventional treatments have not resolved. You have chronic gut issues, you've went into the doctor, you've had endoscopies, you've had colonoscopies, you've done the elimination diets, and like things just aren't moving the needle. I'm like, yep, you've gotten a bunch of Band-Aid strategies, and it's like, what's actually going on? Or if you're someone that's looking to like actually optimize their health, not just kick the can down the road in terms of disease states. Maybe you're someone that you suspect that you have some underlying hormonal imbalances or gut dysfunction or nutrient deficiencies. That's really where more of the functional medicine side of things really shines. Or if you're someone that's looking for more of a personalized approach to your health that focuses on addressing the root causes, right? Looking at the body as a whole and really asking the question, why do I have it? And definitely this surviving to thriving toolbox is for you if you're looking for solutions outside of the pharmaceutical medicine model. So if you're someone that's like, yeah, I'd really rather not be on anti-anxiety meds for my anxiety and spirulactone for my acne and birth control for my heavy periods, and Linzess for my IBS. It's like, yeah, I would agree, because none of those are actually treating any of those conditions. They're just covering up your symptoms. So if you're in the same boat where you're like, yeah, I'd rather not be on all of these pharmaceutical medications for the rest of my life, it's like, then the functional side of things is probably for you, especially with more of those chronic type health conditions. Okay. So there's so many different examples that I can share with you of just like where this has really kind of shown up in my sphere and in my space. But I would say a lot of times you start to see this come out when individuals are struggling with, like I said, the conventional medicine model, trying to answer chronic health conditions. So here's a classic example of, an individual I just met with like actually a couple weeks ago. So I had a potential client come to me. She had recurring gallstones like her whole life, eventually had her gallbladder removed. Even after having her gallbladder removed, she started getting kidney stones, right? It's like, that's kind of odd. Are gallstones and kidney stones connected? Yes, they are. Started getting kidney stones to the point where they had progressed and become like impacted in her ureters. So very severe kidney stones, was put on very restrictive diets because of it. Then she started to develop full-on arthritis, as well as a lot of brain fog and headaches, and then weight gain because of her restrictive diet had her eating like low protein, low fiber, and pretty much just like high carb diet, right? To try to combat the kidney stones. So she has her gallbladder removed. She continues to struggle with kidney stones. She starts to eat this low protein, low fiber, very restrictive diet because her urologist put her on it to prevent more kidney stones. She proceeded to gain about 35 pounds over the course of the next 6 months, and then needed to start a weight loss medication because of the 35 pounds of weight that she gained. And I'm sitting here and I'm like, has nobody helped you? Like, all of these are connected together. And she's like, I knew it. I knew they were, right? And so with some functional labs, specifically around gut health, fungal overgrowths, I was really able to show her, I'm like, all of these symptoms, all the way from the days you were struggling with your gallbladder, to your kidney stones, to your arthritis, to your brain fog, to your headaches, to your weight gain, like, all of these are connected. And so that was just so helpful for her to have literally solution after decades of getting bounced around to Band-Aid solutions. She's like, why did nobody tell me this? Why did nobody refer me to you earlier? And I'm like, yeah, I don't know. They should have for sure. So those are just, like I said, really simple kind of examples of things that I see literally every day in practice for individuals that, like I said, are mistakenly using kind of the conventional medicine toolbox for something that's actually more of a chronic functional medicine solution. So they're getting frustrated, they're getting nothing but Band-Aid solutions, and it's not the fault of the conventional medicine. They have maxed out their whole toolbox and everything that they are trained on. It's like, they're like, you want your gallbladder removed, or you want me to go in and retrieve these kidney stones, or you want weight loss medications, like, I'm here for you. I have all of those things. But if you want to ask the question of why and how are all these things connected together? Is there a solution outside of all these things? That's where you have to look to a different model. And that's okay. So both of these models coexist together. They should exist in synchrony and collaboration side by side. And again, that's what I'm really passionate about. One, educating patients out there to discern what model of healthcare actually do I need so that I don't get frustrated or reach a dead end. And also helping individuals really understand how to get connected to more of those root cause solutions if that's what they're interested in. So if, like I said, this whole conversation around the difference between conventional and functional medicine is really kind of letting off some light bulb moments for you, or if you're even more curious about the differences between a conventional medicine diagnostic workup to a functional medicine diagnostic workup, I got you, right? So if you are curious about that, you always have access to a functional wellness consult together where we'll actually start with some blood work, but blood work more from a functional angle, just to start to dip our toes into this world and to start to understand like what type of lab tests could we really benefit from and what type of overall treatment program are we looking at, because conventional medicine is going to dip into the world of pharmaceutical treatments, surgical interventions, and scopes. Essentially are like their toolbox. Whereas functional medicine toolbox, we're going to think, what nutritional changes can we make? What lifestyle changes can we make? What about nervous system regulation, mind-body medicine? What about supplementation protocols and treatment? That's my toolbox. So it really just kind of depends, again, what you're interested in and really what your goals are trying to achieve. So if you're curious about that, you have, like I said, some opportunities to connect together with our functional wellness consult, or even my Hormone Harmony Self-Starter Bundle will get you really thinking about this functional medicine toolbox to use to your advantage in 2025. So don't hesitate to reach out. You can get all the links in my bio. We'll see you guys next week.